Well, today I am honored to be with Dr. Michael Antimisiaris.
Very good.
Okay, for the linguistically challenged
Yes.
Dr. A.
Dr. A. That's me. Yeah.
Dr. A, thank you for being here, first of all.
Oh, it's my pleasure.
Secondly, you are an electrophysiologist.
That's right.
Okay. Would you mind telling our listeners what that is and what you do?
Well, it's really a subspecialty of cardiology. So after you get your general cardiology training, you subspecialize in electrophysiology, which is really the study of the electrical system of the heart. And as such, we're pretty much dealing with things from the very mundane, like people who have palpitations or skip beats, to the very severe or life-threatening, like survivals of sudden cardiac arrest.
Okay.
And we're dealing with all these arrhythmias in between. So it can start from a very benign but symptomatic, more of a nuisance thing,
Okay.
and it goes all the way to the life-threatening. And we intersect with a lot of, and that's our intersection with your, with athletes get a lot
Sure.
of arrhythmias, and there's always a fine, and now we're recognizing more about this, but there's really a fine distance between what we used to call an athletic heart and a pathology associated with that.
Okay. Now, I think people find it interesting that the heart has its own electrical system. Is that correct?
Well, it is very interesting, and it's obviously very intriguing, and because as humans we've dealt with electricity for some time, and a lot of things that we learned by dealing with electricity we were able to bring into the heart and deal with different heart ailments. For example, you can think of patients needing pacemakers as having a problem with the electrical cabling in the heart.
Right.
And so the pacemaker wires essentially replace that. And it's we do a very small part of the job. The heart is a regenerative organ, so if we apply a small electrical impulse, the heart takes it and delivers it to the rest of the heart. So we can stimulate a very tiny area of the heart with an electrical wire with a voltage of a 5-volt battery.
Okay.
And we're able to stimulate it and capture the whole heart and produce an electrical impulse that way.
Okay.
And that knowledge and that development has led us to be able to miniaturize cardiac pacemakers and cardiac devices and implant them, and that's going now to the next step, obviously.